Osteomyelitis: causes, signs, symptoms, diagnosis, treatment, prevention, and control. Definition: osteomyelitis is an infection of the bone tissue, usually caused by bacteria. It can occur in any bone but most commonly affects the long bones of the legs and arms, vertebrae, or pelvis. Causes: 1. Bacterial infection, most commonly caused by Staphylococcus aureus, but other bacteria like Streptococcus and Pseudomonas can also be responsible. 2. Trauma or injury, open fractures or wounds can introduce bacteria into the bone. 3. Hematogenous spread, bacteria can spread to the bone through the bloodstream from other infected sites. 4. Surgical infection, post-surgical infections can lead to osteomyelitis. 5. Poor circulation, conditions like diabetes or peripheral artery disease can increase the risk of osteomyelitis. Signs and symptoms: 1. Pain, severe, persistent pain in the affected bone. 2. Swelling and redness, swelling, redness, and warmth around the affected area. 3. Fever. High fever, chills, and sweating. 4. Limited mobility, reduced mobility or stiffness in the affected limb or joint. 5. Drainage, pus or discharge from the affected area. 6. General malaise, feeling unwell, fatigued, or lethargic. Diagnosis: 1. Medical history, review of medical history, symptoms, and risk factors. 2. Physical examination, examination of the affected area for signs of infection. 3. Imaging tests, X-rays, CT scans, MRI, or bone scans to visualize the bone and detect signs of infection. 4. Blood tests, blood cultures to identify the causative bacteria and monitor inflammatory markers. 5. Bone biopsy or aspiration to obtain a sample for culture and histopathological examination. Treatment: 1. Antibiotics, long-term antibiotic therapy, often 4 to 6 weeks, to target the specific bacteria. 2. Surgery, debridement, removal of dead tissue, or drainage of abscesses may be necessary. 3. Pain management, pain relief medications to manage pain and discomfort. 4. Immobilization, immobilization of the affected limb or joint to reduce pain and promote healing. Prevention and control: 1. Proper wound care, prompt and proper treatment of wounds, especially open fractures. 2. Infection control, adherence to infection control protocols in healthcare settings. 3. Vaccination, vaccination against certain bacteria, like Staphylococcus